this is another situation that we're having to manage. It's a new situation for us. But look, people are being very cooperative. We've asked people to stop shaking hands and to wash their hands, to minimize the being around large crowds, to engage in social distancing, spacing. And by and large, people are doing that. This last week was a very dramatic week, especially when we see, when we ended these large events. And of course, the city has rescheduled or canceled events that were city produced, sponsored, permitted. So we are doing that, and other people are following the lead. So and the whole notion is to just do everything we can to kind of hunker down over the next several weeks to slow the progression of this virus, so that it doesn't overwhelm our health system. So I'm pleased with the response, but what I will say to people is that this is not like a 1 day or 1 week event. We have to kind of pace ourselves. And then based on some of the reports that I'm getting this morning, people have slowed their pace in terms of rushing the grocery stores and buying everything on the shelves more than what they need for this week or next.
I was going to say, I sensed a little bit when I was listening to you in your press conferences, a little bit of frustration when we see those scenes of long lines, people buying up all the water.
Yeah.
What's going through your head when you see that?
Well,
these are your people.
Because the reality is that one of my greatest concerns is that the panic, the fear, would do more damage to us than the actual virus itself. And I don't want people, no one wants people to panic. I recognize the anxiety levels are here, but we don't want people to panic, which means is that there is no problem with our food supply, no problem at all with our water. The water in the city of Houston is safe. There is no need to go and hoard, toilet paper. There's no need for that. But we just have to be very patient with everyone who's trying to manage this coronavirus. And quite frankly, that's all of us. This weekend, we're spending a lot of time, the county team, the city team, and people at the medical center, we're spending a lot of time to work out the logistics so we can start some additional testing this week. So that's the focus.
Do you know, that was my next question for you, do you have an estimated time when the drive-thru testing might begin?
Now, we're hopeful that it will be this coming week. I will say, in addition to what we are doing in setting up some drive-thru testing sites, that I've gotten word that, for example, that FEMA is offering 1 to 2 mobile testing sites, so that's good. And so certainly welcome that, and and that will help to supplement what we are planning to do. So we're getting there, we're ramping up. And so in the meantime, what I would say to people, look, if you're sick, please stay home, okay? If you have been tested positively, please, and if you're not in the hospital, self-quarantine. If you have been tested, whether by our labs or by some private lab, and you've been notified that you tested positively and you're not in the hospital, please self-quarantine. And people who are living with you, self-quarantine. So those are the sort of things that people have to take responsibility for themselves as well. And then at the same time, the social distancing. Now, that doesn't mean you shouldn't go to the parks. That you can space yourself at the parks. Kids are going to be out of school in many cases until the end of the month. And I know you can't keep kids just bottled up, so you can take them to the parks. There are a lot of parks, but social distancing. It doesn't mean that you can't go to a restaurant. You can. Doesn't mean restaurants can't function. You don't have to operate at maximum capacity because you want to space people out. This, for now, is the new norm. And we all are having to make adjustments for the new norms. And let me give a shout out to the faith-based community. Many of the larger churches are going online or they're not meeting because it's kind of hard to engage in social distancing. But for your smaller, medium-sized churches, where you can have some social distancing, spacing, then they are worshiping and they're doing that. So you just have to kind of assess what your situation is and recognize that it's important for all of us to be more responsible.
Absolutely. Do you have any idea of what the sort of, I guess, logistics or like what the layout would be if you did some drive-through testing, as far as, is there any word yet on what locations would be used or so on and so forth?
Well, we have some idea of on where some of those locations will be, but we're working that out. And so that's what the teams are focused on this weekend. They're working, we're working now, and be working a little bit tomorrow and Monday. But the plan is to have that expanded testing started in the city of Houston, in Harris County, in the region, this coming week.
Gotcha. And would somebody have to already be showing symptoms in order to be eligible for that type of testing, or is it anybody who feels sick could go get tested?
Certainly, we're looking at people who are showing symptoms, and people who have a doctor's order. You know, those are the sort of people who would, let's say, qualify initially. But then there have been conversation about how to expand it even more. So we're working through that. I know I've been talking with one of the council members, for example. In this case, Dr. Plummer, who's one of the members of the city council, just met with her today. She's kind of worked out some things as well that I think will be very, very helpful. So we're looking at different ways that we can expand it in such a way that we can make a better assessment of who's walking around, for example, or who have the virus, and that way we can better meet the needs of the people within our region.
And you've been feeling okay, right? You've been working around the clock and going to all of these, large gatherings to try to calm people's panics and fears. You're feeling how health-wise?
Health-wise, I feel fine. Quite frankly, I'm blessed to be able to represent the city at this moment in time. I appreciate the trust that people have placed in me. This is a great city. I love the city, and that's why it's important for me to do as much as I can. Number one, to make sure that we are putting in place the infrastructure to meet the needs of the people in our community to keep them safe. Sometimes you have to make tough calls, but you call a ball and a strike. And at the same time, it's important for us to be credible and transparent, because people won't believe in us if we're not transparent and credible. And at the same time, it's important for us to say to people, we can manage this situation if we don't panic and allow our anxiety to drive our reasoning. We have to be governed by the facts, the science, and the opinions that we're getting from our medical experts. If we do that, then we'll get through it. And then lastly, what I would say to you, in moments like this, I reflect on how we have come through the Tax Day flood, Harvey, Tropical Storm Imelda. Houston has been challenged time and time again. And I reflect even on my mom's advice. In difficult times, challenging times, my mom used to say that God gives his hardest exams to his best students. Houston is a good student. So, #Houston Strong.
You answered my next question. It's like you've got, you can read mine. I'm going to just back this up. I'll get a shot of the two of us, and then I think you've answered all of my questions, so I can let you go. Plus, I think you're probably ready for your next one.
You need help with the frame? You good?
You know what? If you guys wouldn't mind double checking me, I'd certainly appreciate it. I think I may have gotten it, but sometimes I'm a little tall.
Amen. How are you doing?
I'm doing okay. We're just trying to make sure that, and I know this sounds super cliche by this point because we've said facts, not fear, over and over again.
Right.
But one thing and I was talking about this with Mary, is that we're trying to get people, we're being very cautious about what we show and what we say,
Right.
and how we say it. When we talk about the long lines at the grocery store, we just want to be careful about, wait a minute, we don't want to make more people say, oh my gosh, I got to go to the grocery store right now.
Right.
I mean, that's got to be,
But I think a good story today message is that people are getting the message that they don't have to rush to the grocery stores, and that there's nothing wrong with the food supply chain, and they're starting now to slow down and just buy what they need. Because my greatest concern is that people will rush to the stores, spend a lot of money on food and stuff that they don't need and may waste, and then 2 weeks from now, the extra money that they spent will be money that they need 2 weeks from now. Because this is not a 1 day, 1 week event. We're going to be in this probably for the next several weeks, couple of months. So it's important for people to pace themselves. You know, 2 weeks from now, you'll need to go back to the store and to buy some stuff. So no use trying to buy it all at one time, thinking that's going to carry you through this particular event, because it's not. So just pace yourself, and then bear in mind, leave something for the next person. You know, get what you need, but not necessarily, you know, you don't need to go and stock and like you're putting it in a barn for a rainy day. You know, that's not, this is not that type of event. It's not like a hurricane is coming. It's not that type of event.